Hi everybody, I'm Jean Ketchum, CEO and co-founder of Aging But Dangerous, and we're continuing our series with Dr. Harrington here. And today she is going to talk to us about eyelid surgery. And I don't know what the professional name is, but...
Wonderful. Well, good morning, Jean. So we've talked about a number of things. We've talked about skincare, we've talked about Vivive, which is something we use for incontinence and vaginal lubrication. We've talked about skin tightening. All of those have been, minimally non-invasive things.
Right.
Eyelid surgery is invasive.
Yes.
So, we have to make that kind of quantum leap into that world of that. But I'll tell you, the reason we're talking about it, from my perspective, is that it is the one thing you can do where if you do it, it's easy, it's super low risk, and it takes so many years off your life.
Yes.
That patients absolutely love it.
Mm-hmm.
I've actually had it done, so that's a big
I've
statement.
had it done. I had it done 30 years ago.
Yeah. And so if I'm sitting on a plane, this is what I always say to my eyelid patients. If I'm sitting on a plane and somebody figures out what I do and they want to get my advice, because
Right.
they know it's not in any way going to be, trying to push them into coming to me.
Right, right.
I don't even have to look at them. It's like, just do your eyelids,
Yeah.
And when I say do your eyelids, I'm more referring to doing your upper eyelids.
Okay. Okay.
So upper eyelid surgery takes me easily short of an hour. It can be done under sedation, anesthesia, sort of like the kind of anesthesia that you use to have your colonoscopy done or something like that.
Okay.
We take out skin, muscle, and some fat pads. Not much fat pads, but just the ones that need to go.
Mm-hmm.
And then we close you up with a stitch that we take out in a week. I tell patients you're going to look like a raccoon for a couple days. And you're pretty much able to do anything you want to do with your life in about a week. And it is a game changer.
Mm-hmm.
I'm always happy to show my before and after eyelid pictures. I'm 54. I had my eyelids done about 7 years ago. It's not usually something you ever have to repeat.
I was going to say, mine has really held up too.
Oh, yeah.
But when I had mine done that many years ago, everybody did think I'd had a facelift. I mean, you are so right. It changes. It really affects the way you look. It really changes things.
And it's so important that your surgeon is board certified, a board certified plastic surgeon.
Oh,
okay,
yes.
I know a lot of people that have this done, sometimes maybe through insurance with their ophthalmologist. I'm a little biased on this one. I really think going to a board certified plastic surgeon is the right thing to do if you want to do it for the look.
Right.
Okay. If you want to do it for function and you just want a little skin off, then I'm pretty easygoing. But if you're really doing it for the look, because you want to look like nothing's happened, but yet something's happened.
Right.
So you want to maintain you and not look done.
Right.
You want to go to somebody who's boarded, knows what they're doing, has done many of them. But my patients tell me, my goodness, Dr. Harrington, I love this. And I love it because nobody knows I did it. And they tell me, geez, what's up with you? You look good. You've lost weight. Did you cut your hair?
Exactly.
Did you get a facelift? You look great.
Exactly.
So it's simple, it's practical, it's safe. And I think for, women and men, I do so many men with this. Mm-hmm. And the key to men is to be super conservative so they look really natural.
My husband had it done.
Yeah, nobody wants the too much.
Mm-hmm.
That's not and I could name off people that we see on TV, but nobody wants that.
Yeah.
So you want to be classy about it. But it's the one procedure I would say that's done so frequently, sort of in our age group,
Mm-hmm.
in late 40s to easily do it in your 70s and 80s and be great about it. So it's happy.
Mm-hmm.
So
good.
I wanted to just share that with the group because I feel like it's an important thing to talk about.
Mm-hmm. Well, I have to do this too, and I know you're not prepared for this, but because we hadn't talked about it before. But we have a member that you do that cool sculpting here also.
Yep.
And you see that on TV all the time. But we had a member that came here and you did that to her in her stomach. And I talked to her the other, she just had it done, I don't know, like a couple months ago. I talked to her the other day and she said her tummy is completely flat.
Yeah.
I mean, I saw her tummy. it was, she really, had some fat around there. That is just shocking, but so many women want that flat tummy.
Yeah.
Can you just address that just for a couple of,
I'll be
just
quick.
a minute or
And
something?
it warms my heart because, as mentioned, I've been this plastic surgeon for 19 plus years.
Yeah.
And I never dreamed I would get into technology. I was always the sort of trite and true, very conservative plastic surgeon that just wanted to, do what I do and do it well and not rely on technology, because technology can be something that there's an unknown to it. So Cool Sculpting is my very first technology.
Oh, okay.
It was the one that actually allowed me, the results are so consistent and so good that it allowed me to believe in technology. And so from there, I've grown into other things that I've vetted out very carefully. Sometimes people read negative things about Cool Sculpting on social media,
Right.
or they see it, they hear people talk about it. And I will tell you, the reason they read those reviews is because they didn't have it done the right way.
Okay.
Okay? I had it done as a free demo, never intending to buy the thing. I had it done when I was just sort of in a little bit of a rut. I was in my late 40s. I was gaining weight around my middle, and I thought, I'm going to do this and not tell anybody about it. Not believing it would really work to get me excited. My before and afters are online
And
on
you
my
did this
website.
how many years ago?
I did this, it's been 6 years.
Okay. Wow.
Okay.
All right.
And I had such an astounding result, noted at about 8 weeks out, that I bought 2 machines. And I will tell you now, in my clinic, I have 4.
Wow.
So it's freezing fat. And when you freeze fat, fat cells basically just implode. We call it cryolipolysis, which is our big word for it. But we basically get rid of those fat cells, so they can't come back. It's a beautiful thing. We can treat almost any area on the body with it now.
Okay.
So we treat frequently, abdomens, hips, inner thighs, back fat, fat here, arm fat. We
Really?
treat.
You can do this?
We can.
Oh my gosh.
Yeah.
And she is in her early 70s. So we're not talking about a 50-year-old here.
Yeah.
Early 70s, and this tummy just got so, it's just so exciting, these things you're doing.
It is. And that is a non-invasive. You come in, you don't go to sleep. We do it, you leave, you can go to the gym. You're going to be sore for a couple weeks and swollen, but you can live your life. But again, I have to repeat, it's so important that you have it done the right way. Now, I will tell you that in my clinic, we treat every patient the way I was treated, which is not exactly how they got their FDA approval, which means I actually double treat everybody on the first day. So when you hear about unhappy patients, it's usually that they just had one little treatment for one little hour and they weren't treated to completion. Nothing in life is that simple. So if you want to have a successful result with Cool Sculpting, which everybody wants, you have to treat each area that you want to treat to completion, which means it's not just one cycle. So if you see this thing on a Groupon or from a Medi-Spa and it seems simple and easy and cheap, no.
So how does it compare to a tummy tuck?
So a tummy tuck,
Because a tummy tuck's invasive, right?
a tummy tuck's a big deal. Tummy tuck can be a great thing, but it's a big deal.
Okay.
It's a big scar. It's a lot of recovery.
Okay.
Typically my patients have the wind out of their sails for about 6 weeks.
Oh, wow. So this does the same type of thing?
Well, it's different. Okay, a tummy tuck is taking away fat and skin.
Okay.
And tightening up your abdominal wall
Okay.
to sort of bring things back before baby.
Okay.
Okay?
Okay.
Whereas Cool Sculpting is essentially, in layman's terms, dissolving fat.
Okay.
It's similar to liposuction.
Oh, okay.
Okay?
Yeah.
But liposuction is invasive, whereas Cool Sculpting is non-invasive.
Okay.
Okay? They're both great, I think, for treating areas that we just struggle with and just can't stand. Again, it's a game changer, to be able to put something on and feel good in your skin and have it be essentially permanent
Yeah.
and not have to go to sleep.
Right.
That's called Cool Sculpting. But again, you want to go to a clinic where they know what they're talking about. They aren't going to sell you something that's not going to meet your expectations. Every meeting I have with my staff is about meeting expectations to our patients. I do not want to ruin my great reputation. So you meet with somebody, you kind of go over what you got, you hear what they want, and you got to make sure the two come together appropriately, or you don't do it. I hear of people getting cool sculpting that are not good candidates. So if you think this sounds exciting and you want it, just make sure that you're going to a reputable place that knows what they're talking about, that's not going to push you into something that's not going to meet your expectations. So for example, me, you know, in my toolbox, I have everything. I can do liposuction, I can do a tummy tuck, I can do cool sculpting, I can do whatever. So I don't need to sell them anything. Whereas when you go to a place that only has cool sculpting, they tend to want to bucket you into that even if you aren't the right person for it. So can it be great? Yes. Is cool sculpting, I think, a household name? Yes. Does it change people's lives in a very positive way? Yes. Is it non-invasive? Yes. Is it amazing? Yes. But you have to be right for it. Does that make sense?
Yes, it makes sense.
So, but
And
fun to bring that up. Thanks.
Yeah, like I said to you before, I mean, it just seems like you're so conscientious. You're so, I love that. You know, you do have such a great reputation here in the Twin Cities, but you have a lot of people coming to you from other areas too, right? I mean, we go out, we cover, well, we cover the world, but we cover all of the United States as far as Aging But Dangerous goes. So you do get out of town people.
Oh my goodness, you know, well, the world's changed with technology, right?
Right.
And so, you know, I would say my travelers are almost as big a portion of my practice now as local people.
Wow. Okay.
Because, you know, we're Midwest,
Right.
so our philosophy and prices are a little different than the East and West Coast. And so we get a lot of people who come in and for less cost have a great experience with great anonymity. And so I'm a real advocate of travel. I think it's nice to, you know, take a minute for yourself, see a new place, experience something great. So we're doing a lot of this stuff now for people that are bopping in for a day or two.
And the Twin Cities is such a fun place to come to. So thank you so much again and again, Dr. Harrington, for, you know, giving us all this information. And I know everybody that sees these videos is going to be so excited. So, you know.
We'll have to do it again.
Yeah.
Yeah.
Thanks.
Yeah, you're welcome. Have a great day.
Okay.